Welcome to Seeing Eye to Eye here on blackdoctor.org. I'm your host this evening, Shamika Rhymes. Let me know in the chat where you are watching from this evening. And don't forget to share this with your network. And as always, if you have any questions at all tonight, drop it in the chat. So, we've got a holiday coming up next week, actually, 4th of July. So tonight's panel is focusing on an important and timely topic: fireworks injuries. Every year, especially during the holidays and celebrations, thousands of people suffer from injuries because of fireworks. And many of those injuries affect the eyes, sometimes causing serious and permanent damage. So tonight we're going to talk about how these injuries happen, who is most at risk, and most importantly, how you can stay safe while enjoying the festivities. So again, if you have any questions at all tonight, be sure to drop it in the chat. So let me introduce you to tonight's panel. Tonight, we've got Dr. Julia Stevenson. She's a board-certified plastic and reconstructive surgeon and the founder of Cardinal Plastic Surgery. And she made history as the first African-American graduate of Penn State's plastic surgery program. That is huge. So let's welcome Dr. Julia Stevenson.
Thank you for having me.
Hi, Dr. Stevenson. How are you?
I'm doing wonderful. I'm excited to speak about this topic.
Oh, I can't wait. Next up, we've got Dr. Nicoletta Finn Thompson. She's a Harvard-trained ophthalmologist specializing in cataract surgery, corneal transplantation, and anterior segment disorders. And she is, she has been published extensively, and she continues to speak nationally and internationally in the field of ophthalmology. So let's bring on Dr. Finn Thompson.
Hi, everyone. Happy to be here.
Hi, welcome. We're so excited that both of you are here tonight. And I see in the chat, we have Gastonia, North Carolina checking in, and Asheville, North Carolina. Welcome. Carolina's representing. So look, I'm going to start with you, Dr. Finn Thompson. What time of year do firework injuries most commonly occur?
So they actually most commonly occur around this time of year, around the summer months, right? So mid-June to mid-July. And actually, especially with the upcoming 4th of July celebration, it's a common time when we see these injuries.
I was sitting here, when was this? Last week, and I had no idea people were doing fireworks for Juneteenth.
Yeah.
So, Dr. Stevenson, how do these fireworks injuries occur? Like, what are people doing to cause these injuries?
Well, I think it's important to consider, again, like you mentioned, why people are celebrating. So, not just the summer months, you have New Year's Eve. A lot of times people use it in celebratory fashion. And so you have distractions. People are associating celebrations with fun. And so sometimes people lose the context of the seriousness and how dangerous some of these things are. So you are in a fun atmosphere. You can have distractions. So maybe attention may not necessarily be paid to the surroundings, pets, children that may interfere with you really concentrating on the fact that you have these really dangerous objects. And again, you can put alcohol in there too. So there's a lot of different contributing factors as to how and why these injuries happen. But a lot of the times it can really be distractions.
Okay. I was going to mention alcohol, but, and I even thinking about when I start to hear the fireworks popping off, it's usually the later hours, sometimes 10, 11 o'clock after a day of celebrating. So that makes total sense.
And you also, and I was just also thinking, cities can have their own celebrations, but, once they do their finale, you end up hearing the pop, pop, pop in various neighborhoods, backyards. Again, not necessarily environments where people may not be considering, is it safe to have these kinds of explosive devices in their backyards where there's flammable, objects and things. So.
Oh yeah, that's a good point. Well, what types of injuries can occur from these fireworks, Dr. Stevenson?
So you can have a variety of injuries. You can have burns, which is the most common thing people have. You can have explosions. So because it's basically an explosive device, you can have injuries to the hands, the face, the eyes. Those are the most common things because of the energy that's exerted. So you can have amputations of fingers, so fingers actually being torn off, nerve injuries, tendon injuries, things that can affect the function of your hand, your face, your eyes for the rest of your life.
Hmm. Yeah, I don't think people think about that. They're just thinking, yeah, let's have fun, and then accidents happen.
Yeah.
Dr. Ben Thompson, what percentage of firework injuries are eye related?
Yeah, so it's actually significant. So about 19% of injuries affect the eyes. And of those, the type of injuries that we see globe ruptures or open globe. We see, again, because it's chemical or thermal burn, so that can be superficial, affect the skin, the eyelid skin, also the surface of the eye. We can also see corneal abrasions. So the front part of your eye, the cornea gets abraded, significantly painful, risk for infection and scarring. And also penetration to the back of the eye, you could see retinal detachments.
Wow. Well, Dr. Finn Thompson, who are the most common victims of firework eye injuries?
So it may not be who you think. So actually, usually young children are about a third of the percentage of people are young children, so less than 15 years of age. However, particularly for eye injuries, those that are young adults, 15 to 19, those are the ones that will most commonly have emergency room visits. So it's the younger population. Yeah.
Yeah, I wasn't expecting that answer. You're right. I was not expecting that. I thought it was going to be the adults. Um, I see some firework emojis in the comments. I see y'all. They're saying beware. Thank you, Tracy. This question is for both of you, and I'll start with you, Dr. Stevenson.
Mhm.
Is it dangerous to be around fireworks? Like you actually kind of mentioned this earlier when they're shot off by friends and relatives.
Yeah, it can be because again, you have to consider. I think in this age of social media, I think we've all seen videos of fireworks gone awry in people's neighborhoods where if they malfunction, they may not explode or do whatever dazzling thing you want it to do at the time that you thought it was going to do it, or go in the direction that you thought it was going to go in. And so if you don't consider your surroundings and the potential of it, you know, going across the street to a neighbor or somebody, you know, driving by or into your kitchen window, again, things that people don't consider, their actual surroundings and really being prepared for the what ifs. And then additionally, not having the appropriate things around in case those things happen. So when people, you know, are injured, you know, what do we have in place that should something go awry? Again, we think of house fire, stop, drop, and roll. What do
Mhm.
we have prepared for, you know, someone actually having an injury? Do we have water? Do we have a fire extinguisher? Do we have the things around us? A lot of people, again, think it's just celebratory and fun and, oh, what harm can come from this? And so, you know, lack of preparation of, you know, the potential harm that can be caused is a really big one.
Absolutely. I'm thinking of I in my former life as a reporter, I was thinking about I did a package on
Mhm.
fireworks safety, and even then, and because of the heat that we have right now, this heat wave, it reminded me of
Mm.
because of the heat, you've got to be careful because of that as well. Dr. Finn Thompson, what are your thoughts on being around friends and relatives shooting off fireworks?
Yeah, I think bystanders are actually also a great percentage of people that are affected. So when you don't expect it, not only when you are watching, but also if you are standing next to somebody that's also letting off fireworks, particularly in the home environment. So in states where it is legal to have fireworks, bystanders are more frequently affected.
Okay. And just reminding the chat, if you guys have questions, please drop them in the chat. I'm checking it. All right, Dr. Stevenson, can you talk a little bit about some of the other injuries that can occur from fireworks from your perspective as a plastic surgeon?
Yeah, a lot of times people, because there tends to be a misconception about what plastic surgery actually is.
Mhm.
A lot of the injuries that are sustained with fireworks, plastic surgeons have to address. So the most significant one, which is almost half of all the injuries from fireworks, are burns. So it can be something as, very, very superficial in the skin. So where it's, you just need some antibiotic ointment to take care of it, or something really, really deep where, you have to have multiple surgeries with multiple reconstructions that can end up leaving you with, scarring that can leave you, deformed or not being able to use, your extremity, or even when we're talking about eyelids, that the skin of the eyelid is very, very thin. And so to try to reconstruct that, you may be dealing with these issues for the rest of your life. So, needing to have multiple surgeries because of the scar tissue and inability to close your eyelids, inability to use your hands. So, if you're a manual laborer, that's your occupation is now affected. A lot of things that really people don't consider. So for plastic surgery, we deal with hand injuries. So whether that be fractures, tendon repairs, nerve repairs, and there's significant rehab that goes into all of these. So it's not just a once and done. Some people might be fortunate enough to, again, just have that superficial burn that doesn't require any surgery, but a lot of the times it can be something very significant.
Okay, thank you. Dr. Finn Thompson, what should you do if someone has a firework related eye injury while waiting for medical attention? So if they've gotten injured, everybody's kind of standing around like, what do we do while we wait? What is your response to that?
So the first thing is that any eye injury is an emergency. And so every injury is an emergency. So you seek medical attention, or if you can't get there, you call 911. I think the first thing you want to do is, because you don't know the extent, particularly of the eye injury, you want to protect the eye. So you don't want to rub the eye. You don't want to put pressure on the eye. You don't want to remove any objects that may look like they're stuck on the eye. You actually don't want to dislodge them. You just want to leave them. You don't want to think about applying any ointments or anything like that, because that can actually make the injury worse. So you just want to leave the eye be. If you actually have like a cup that you can cover the eye, if it really looks pretty mangled, that's a good idea, but nothing with pressure. And again, it's an emergency. Seek medical attention. If you can't get there, then call 911.
Should they not? Well, I'm guessing since you said don't do anything, we can put a cup over it. What about water? Because we sometimes hear flush. Nope, leave it alone. Okay,
I actually would not do that. I would actually
okay,
not. Yeah. Yeah.
okay. Dr. Stevenson, you kind of explained this a little bit, but why would a plastic surgeon be involved in the care of patients that are suffering from firework injuries, and what kind of surgeries might they need?
Yeah, so again, just as I was mentioning before, so again, burns. And sometimes with burn care, that can be initially when people present, you may not actually know the full extent of the injury from the burn, and it's something that might take more time to determine what kind of surgical care is needed. And so, what we typically do is we try to do cleaning of the wound and making sure it stays clean, um, surgically removing any tissue that may not survive so that people don't get infections. And then also, again, when we're talking about hand injuries, big thing is, again, if there have been amputations, can those fingers be salvaged? Can we stabilize and reconnect the blood vessels so that those as many fingers as possible can survive so that people can use their hands in the future? Because again, if you consider um, when you're lighting a firework, you most likely have it either in your non-dominant hand because you're
Mhm.
using the dominant hand to light it. And sometimes then you switch it over. So the hand that's used, again, is very significant, particularly when we talk about people's occupations. So trying to salvage the digits or the fingers if possible. Um, and then going from there and figuring out kind of function can the patient have, or what can we do again to salvage this, so that knowing what they do for their occupation or what they do for even just socially, because we're social people. Do they crochet? Do they do things that bring them enjoyment? And how is this injury going to affect them? And then additionally, we come to the face, working with a lot of other specialties. Plastic surgeons we work with, we do joint procedures with a lot of other specialties. So especially with ophthalmology, if we're trying to, again, salvage the eye and making sure that we have functioning of whatever eyelid possible. So if the actual globe or the eyeball has not been injured to the place where it needs to be removed, okay, so it still needs to be protected. Your eyelid protects your eye. So what do we need to do to reconstruct the eyelid? Is there enough to do that? What kind of time frame are we looking for? And again, some of these can take months to years to really see the extent of the disability that these can cause. So plastic surgeons were involved with the reconstruction and bringing as much restoration to the form of whatever was injured and the function, because we want to get people as close to their norm as possible.
Okay, thank you. I didn't realize it was so, that it would take that long over time. That makes absolute sense. Dr. Finn Thompson, can you talk about treatments for firework eye injuries and what kind of surgery that people may need?
I think I don't want to underestimate what Dr. Stevenson said is that, we also deal with the eyelids. And so you're dealing with a blunt force, heat, and chemical exposure to the eyelid skin or to the surface of the eye. And so on the eyelid skin, you really need to determine, is this a superficial laceration or superficial exposure that's dealt with even on the surface of the eye, say on the cornea or on the white part of your eye, the conjunctiva and the sclera? Is it something that is superficial that can be dealt with? Or is this so much more deep that it's actually causing melts and can also cause perforation? And so a lot of the medical management is really dealing with, particularly on the eye globe, if it's not penetrating, and that's sort of the worst, is dealing with the risk for infection, the inflammation, and also the risk of the management of the pain, because the cornea is extremely sensitive. It has about 100 times innervation any other part of our body. So any disruption on the surface, like a corneal abrasion, is extremely uncomfortable and painful. But then once you deal with all of this, you also have to deal with potential scarring that occurs. So Dr. Stevenson spoke about the scarring on the eyelids, preventing it from closing, but scarring on the cornea or on the conjunctiva, the white part of the eye, can also affect how the eyeball functions and how you see. Now, if the injuries are more penetrating, and so that would require surgery. So if there's foreign body, foreign material that's in the eye, or even, and that's called an open globe or ruptured globe, that is an absolute emergency, and that requires surgery to be repaired. And that's to just restore the integrity of the eye, and then consider down the road potential loss of vision or loss of the eye, depending on how the eye heals.
Okay. Well, next question is for both of you and from your both of your experience. But is surgery always required for injuries, especially eye injuries, or do you see kind of in your experience that there hasn't always been a need for surgery when something like this happens, Dr. Stevenson?
And I'm going to leave the eye to Dr.
Okay. Okay.
But typically, if the emergency room is calling plastic surgery, it's because there's some kind of intervention that's needed.
Okay.
That's just the nature of it. If somebody's coming in with a really superficial burn, the ER will just say, take care of this, and it's not that significant, then they'll follow up with us, maybe in the outpatient. But the nature of how extensive these injuries can be, if they're calling plastic surgery to evaluate it, most likely it needs surgery. I would probably say injuries where they would call plastic surgery, but it not necessarily need surgery, are some of the deeper burns, where it's a matter of we just need to watch and see how the tissue tells us if it's going to live or not. And there's patience in that. A lot of people think it's like, go to the ER, get this thing taken care of, might have surgery, might have to recover. Sometimes this stuff takes a long time to really determine if anything else is needed. Because again, if we're talking about a hand injury, there's not a lot of skin on the hand. So if there are things that can be salvaged and kept, we want to give the body the opportunity to do that, while also weighing the risks for infection and what's needed to reconstruct in a timely fashion, so that, again, we can get the patient back to being able to use their hand. Or again, if there are any other potential injuries, being able to reconstruct that to get the best outcomes possible.
Okay. Dr. Finn Thompson, how about you? Is surgery always required for the eye injuries sustained from fireworks?
Yeah, I think that's a good question. I think immediately, not necessarily. So not all injuries require surgery immediately. However, we have to just really remember that a lot of these injuries, it's not just sort of, as Dr. Stevenson said, done, treated, and then you're fine. So the consequence of a very bad corneal abrasion can cause scarring of the cornea that then in few months, if it doesn't clear and it's visually affecting the patient or visually significant, may require some type of corneal transplantation or some type of corneal procedure if it's not healing. So I think the answer is twofold. Sometimes, not always initially, but sometimes down the road, yes. Yeah. So these patients really have to be followed for for months. For months.
Yeah. Which goes into my next question. How extensive is the recovery from those eye injuries, Dr. Finn Thompson?
Yeah, so the recovery can be months to years, to be honest with you. So a corneal abrasion, if it's significantly, if it's 100% of the epithelium is abraded, sometimes those patients don't heal. And sometimes they need office procedures or surgical procedures. And this could be months, right? We kind of proceed up a step ladder of treatments, right? And they may never heal. And so then they may need corneal transplantation after that. If they have lid injuries with scarring of this lid skin and have difficulty with eye closure, that's a chronic problem. Then we refer them to our oculoplastics or practice specialist for them to deal with that. But that is something that they may continually need surgery on to deal with. So it can be a long road. It can be definitely a long road.
Yeah.
Okay.
And I wanted to add on to that. So, taking it from a hand perspective, but also, considering the eyelids too. Something that I'm commonly asked just with, surgery and recovery. In an ideal situation, healing, the body heals up to a year after surgery.
Yeah.
So I can do a breast reduction on somebody and, up to that 10, 11, 12 months, their body is still healing on a microscopic level. People see the biggest difference in the first 3 months, but your body's still healing. And so when we even consider a traumatic injury where you have, again, burns, a blast injury where the tissue can be torn, loss of circulation, a lot of injury that can't necessarily be measured by looking at it. You're even looking at a longer period of time for your body to declare how you're going to heal and what kind of function you're going to have of that eyelid, of that hand. So when I use the context of a hand injury, you have the repair, you're still recovering from the burn, your body's still recovering from the tendon repairs, the nerve repairs, so you don't have sensation. And on top of that, you got to start hand therapy. Hand therapy is the hard part. The surgery is the easy part. You have scar tissue. How are we going to be able to manage that scar tissue? Is that something that we will be able to help with surgery in, 6 to 9 months? If we go in to take out that scar tissue, Will that help with the functioning of your index finger? We don't know.
Mhm.
So there's always a lot of question marks when it comes to the surgical
Mhm.
care, where we also don't know what the outcome's going to be. It's only time and seeing how your body heals that, okay, this is what we're presented. You're unable to, bend your thumb and you need your thumb to grip.
Right.
What do we think the cause of that is? Is it because of that tendon repair? Is it also because of the burn tissue and the scarring there?
Mhm.
So it's really important for people to understand these are chronic issues that as time goes on,
Yeah.
they look like they were okay, but it's really hard to say um,
Mhm.
how you're going to heal and in 5 years what it's going to look like. Are you going to need something else done?
Very true. And that's what I've heard so much, that everyone heals at a different pace as well. Um, and I love the analogy that you just gave us so that we could understand the difference in healing from a surgery you planned versus one that wasn't
A
quite
controlled
planned.
environment, you're still healing 9, 10, 11,
Right.
12 months. A
Yeah.
blast injury with chemicals, burns, all that kind of stuff, that's a complete unknown.
Hmm. Yeah. Dr. Ben Thompson, can fireworks cause permanent eye damage or vision loss?
You can, unfortunately, they can. So, the most severe injury is an open globe or a ruptured globe, where there's a hole created or perforation in the eye. And that can certainly cause sometimes loss of the eye. So sometimes we have to do what's called either an evisceration or an enucleation to remove the eye because we can't put it together. But even if those are repaired, certainly that patient can have long-term loss of vision. Or decreased vision. Other injuries like a retinal detachment, so from scarring or inflammation, maybe because there was a foreign body in the eye or just from the trauma, from the blunt force, retinal detachments can cause permanently decrease and loss of vision. Anything in the front part of the eye, again, may heal, but or may not heal as properly as we want to, because depending on the patients, the age, just how they're healing or any complications they have, primarily infection or inflammation can cause scarring, and that can cause a permanent decrease in vision.
Okay. Dr. Stevenson, besides the eye, and you mentioned the hand, are there other long term effects that can come from fireworks injuries? Have you seen someone, their foot or their leg or anything else be
Oh,
injured?
absolutely.
Yeah.
Yeah, because again, you have to consider the clothes people wear are flammable.
Good
So it
point.
may not, if we're talking about the explosion of something that's igniting, anything can be on fire. So again, burns would be the major thing, and also going along with that, blast injuries. So if there's any fragments of the fireworks that might get embedded anywhere else on the body, um,
Mm.
and with burns to the chest, those are all very difficult places to reconstruct because the scarring usually is not optimal. So those are probably some of the additional places when you think of where
Mhm.
things would land on a person, clothing
Right.
items, and what else could potentially set on fire that could
Mhm.
cause burns.
Wow. I want to remind everyone in the chat, please drop your questions if you have any. And I love the emojis. Thank y'all. um, I guess this question is for both of you. What is the surgical and non-surgical care needed to recover from firework injuries? We've talked a little bit about the surgical aspect, but once this person is at home, what kind of care should they do to, to aid their recovery? Because again, with planned surgeries, like I'm about to have surgery, I have over planned. I have my whole plan like ready to go. Everything's ready. But for someone like that has a blast that they did not expect, and now they've got burns, now they've got something wrong with the eye. What can they? And they've gotten surgery, or maybe they didn't have surgery. What can they do to recover from those injuries? Dr. Finn Thompson, I'll start with you.
Yeah, so I think, a lot of this is unexpected, right? So it's not pre-planned. I think
Right.
the thing is to recognize that you've had an injury and that you need to prioritize yourself and prioritize your healing. So be healthy, rest, take time off of work, take time off of school and your obligations, because you really need to prioritize yourself. I think the second thing is that make sure you have, if you can, adequate support if you don't think that you can manage it yourself. So for us, from an eye standpoint, sometimes if you have a corneal abrasion or even an infection, you're putting drops in your eyes about sometimes every hour to 2 hours the first few days around the clock. You don't get to rest with that. So you really want to make sure you can adhere to what the recommendations are. So if you can rely on support or identify someone to help you. And I think the second thing is really make sure that you follow up, right, with the doctor. Oftentimes you may say, oh, I feel better and I don't need to go, or I'll skip this appointment. But from an eye standpoint, and I think it's the same thing with plastics, our appointments, particularly if you have injuries, sometimes are daily for the first week or two, because we really need to monitor healing. We need to monitor risk for infection. And for us, really need to monitor the inflammation, the inflammatory response, because your body is reacting to the injury, which is great. But that inflammatory response in the eye causes scarring, which down the road can affect your vision. So as ophthalmologists, we're managing, the treatment of the infection and inflammation, but also trying to allow you to heal properly.
Those are good points. Thank you. Dr. Stevenson, how about you? What is your advice for recovering from those injuries?
Yeah, so I will piggyback off of the support and prioritizing yourself. Again, with the example that I'll use that's most extensive need for post-injury care or hand injuries is going to be making sure that you have the sometimes it's visiting nurses, and probably the thing that's most difficult with hand injuries is the fact that, again, everybody uses their hands for their work. And the thought that, I just need to get back to work. And sometimes that guides treatment. If that means, we're not going to replant a finger because you're like, you know what, if I'm going to be out trying to do therapy, trying to get this one finger working again, I would rather just take it off and I can get back to work. Because the real talk, people need to work money. But having a support system and the people that are caring for you should be able to connect you with social services to get you the visiting nursing, to help with financial assistance for dressings, because it's not cheap, unfortunately, to get all of the supplies that you need. And, with the reality of visiting nurses probably only come once a day, but you probably need your dressings changed twice a day or 3 times a day, making sure that you have people available or something where that's still able to be done to optimize your healing. Nutrition is extremely important because you have to have the building blocks to heal. Again, my office is a judgment-free zone, and smoking is always a difficult thing to stop doing, but that also, significantly affects nicotine, and smoking can affect your healing in the process of post-injury infections and complications. So those would probably be some of the big things that I would mention. And if you are unable to go to hand therapy, because again, none of that stuff, it's necessary, but it's not cheap. Not everybody can get to some place 3 times a week. You may not have transportation. But coming up with some other way that you're able to stay as compliant as possible with hand therapy, because the hand therapy is the important part and it's the hard part. That you can have a completely successful surgery. But lack of hand therapy can make it or break it. And so it's really going to be important for people in whatever capacity being able to figure out how they can make that happen.
Absolutely. I was just thinking, I had wrist surgery, and hand therapy was so important. It was like, I didn't want to take off work, but I wanted the function of my hand. So I made sure I was there.
and it's unfortunate that access is a problem. So you mean tell me I got to come here 3 times a day for you or 3 times a week for you to beat up on me? And I can't get there, or even if I wanted to, I don't know if I want to.
Right.
That's the hard part of the recovery.
Absolutely. Um, Dr. Ben Thompson, how do we avoid these eye injuries with fireworks? Because, like we said, next week, July 4th, people are going to have the fireworks out. How can we actively and intentionally avoid these eye injuries?
Yeah. So, fireworks are spectacular. They're beautiful to see. They bring people together. Everyone is in awe. I love fireworks. I'm not saying that we shouldn't admire and go and see fireworks. Honestly, the probably the safest thing is first is to plan to see fireworks that are professionally and publicly displayed. And with that, you want to follow the recommendations. So you want to respect the barriers that they lay out on how close you can be. For public and professional fireworks, usually it's around 100 feet, 500 feet, excuse me, from where the fireworks are being deployed. But also as a bystander or a spectator, you actually should be wearing eye protection. So there's the American National Standards Institute, ANSI, who actually has a criterion for adequate eye protection. So you should look up and see what's adequate eye protection for that. And you should also just maintain, be aware of your surroundings, right? And of course, this is more just speaking about the public. We'll talk a little bit more if it's permissible at home or in your state to have home fireworks, but those are the primary things that you really want to do. I think that'll make you be the safest so that you can enjoy the spectacular display that will be upon us in about a week.
Mm-hmm. Absolutely. Dr. Stevenson, how do you avoid other types of injuries with fireworks? We just talked about the eyes. How can we protect those or prevent those hand, leg, chest, face, all the other injuries?
I think a big thing is staying vigilant and not getting too relaxed. Again, we had mentioned, substance use, so a little alcohol, which can affect your reaction time, getting a little too, comfortable, laughing when these things are being done and not really paying the respectful attention that you should be, even with things that we consider very child friendly. But I think it's a matter about staying vigilant, because that's often when the injuries happen. When people are like, oh, I'm just going to do one more. Like, oh, this one. And you get a little too relaxed. I think that's also another important thing too.
Absolutely. So since you mentioned the ones for kids, Dr. Ben Thompson, are sparklers safe for young children because they love those so much? And what eye injuries can occur from those?
Yeah, so really a very important question, and they're not safe for children. So we tend to think because they're small, they're on a stick, they're controlled, but they are absolutely not safe for young children. And in fact, the reason it's not is that they're thermal, and so they cause burns, which are the worst kind of injury that you can have. And sparklers can reach up until 2,000 degrees Fahrenheit in heat. And they're in close proximity. No one really they're pretty close to you. And right when you least expect it. So they are actually unsafe, particularly not for young children.
I never thought about that. I guess I didn't realize how hot it can be.
Very hot.
Yeah.
Coming off here and there.
Yeah. Well, what other injuries can happen from those sparklers, Dr. Stevenson?
Again, it's the burns, just like she mentioned. Again, going to the eyes, going to the hair, going to clothes. And again, it's the things that you don't consider, where that little ember goes off and it's sitting there and you don't realize that it's starting to smoke, because again, everybody's having a fun, good time laughing and joking without really considering the reach of those sparkles. Are you close to gasoline? Are you close to other flammable things, because people consider it so benign?
So this just popped up into my head, because when you're talking about the embers just landing somewhere, go with me on this one, because it just popped up in my head. For those of us that may decide for the holiday, I want to wear a wig, or I want to put some extensions in my hair, whatever it is. How dangerous is that if an ember lands on that?
I mean, if it's combustible, if it's flammable, do you have other flammable products in it? Again,
Mhm.
all it takes is that one little spark, and that's it. But again, that's the thing. People
Mhm.
aren't considering the surroundings and the other things that could ignite
Mhm.
your issue.
Right.
You don't consider it. So
Mhm.
yeah, it's a matter of being very mindful of everything in the environment, including you.
Right. Exactly. I think that's the key part. Y'all hear that? Including you. Dr. Stevenson, we also know that some teens go behind their parents' back and they get access to fireworks and sparklers, and then they engage in some risky behaviors. What
Mm.
should parents know about, and how should they talk to their teens about how to keep them safe?
Yeah, the age group like 15 and 19 are the ones that have the most ER visits when it comes to firework injuries. It's
Mhm.
risk-taking behavior. You got your teenagers,
Yeah.
test the waters.
Mhm.
Everybody likes to put fire to something and hear loud noises. And so it's really a matter of, again, if you're in a place where it's legal for you to have,
Mhm.
fireworks at the home, whether, firecrackers, those kinds of things, I think it starts with, again, a healthy respect for what it is you're doing and doing those types of things responsibly.
Yeah.
It's just like with teen driving,
Mhm.
distractions, um, focusing on the task at hand and not getting too comfortable that bad things can't happen. Um,
Mhm.
but that is the 15 to 19 age group. It's the risk-taking behavior and really recognizing that there are truly really bad injuries that can affect your life. That's the beginning of it all. You being a teenager, for you to have some of these injuries that are going to affect you for the rest of your life, whether you lose an eye, lose a hand, lose some fingers.
Mhm.
That again will affect your ability to some extent to do things that people may consider occupations or things that they would like to pursue.
Mhm. Yeah. Dr. Finn Thompson, if fireworks are legal in your state and you use those permissible for home use, what do you need to have on hand to prevent injury or address an injury?
Yeah, so I think again, if you decide to use fireworks at home and if they are legal in your state, I want to emphasize again is one, do not allow young children to have or to play with fireworks. That is not for them. And if you do have the young adults, 15 to 19-year-old, they need you to supervise what they are doing. So I think those are the two most important things, because not only are you caring for yourself, but those that are around you. I think you also want to make sure that just like you would in a public professional display, you also want to have eye protection and make sure it's adequate eye protection, not only for the user, but also for the bystanders, right? So not the one that's setting off the firework, but also those that are watching it. Um, there's usually recommendations like you have to be about 20 feet away for the ones that are used at home. But again, you have to check with specifically what the firework safety label says. You want to be outdoors. You don't want to do them indoors. You don't want to do them inside a glass jar or inside a plastic bottle. You want to be in an outside clear space where there's really nothing around you. And the
Mhm.
second thing is just to have on hand, just in case, is really just a bucket of water. Bucket of water, because if there is a fire, yes, you want to douse that person, right? But also, if you have fireworks that are duds that don't deploy, people are tempted to then go and like play with them or to touch them or to squeeze them. And that's sometimes when injuries happen. So if you have those that don't deploy, you actually just want to put water on them to shut them
Mhm.
off. So those are the primary things that you really just want to pay attention to and at least have that available. And again, if an injury happens, it is an emergency, 911 or seek medical attention.
Well, thank you. Gosh, this conversation has been so good and informative. But as we wrap up, what is one thing that you want the audience to remember going into the holiday or any holiday for the rest of the year? And if they're thinking about fireworks, what do you want them to know and remember? Dr. Finn Thompson, I'll start with you.
So I think, it's a celebratory time. It's a positive time. And I think we can all enjoy it. But just with most things, you want to be educated. You want to follow the protocols, and you also just want to be prepared. And so I think we've outlined really the risks, the protocols, and then just how to be prepared and how to manage if that situation happens, how to address it. But again, it should be enjoy. Most things can be enjoyable if everyone respects and follows the guidelines that are given.
Absolutely. How about you, Dr. Stevenson?
Yeah, I agree. And I think that, again, maintaining a healthy respect for what you're dealing with, because again, it is very easy to get distracted. That's usually when those types of things happen, when you're going through lighting certain things and you just think it's one after another. You get a little too comfortable without really taking care of your surroundings and what you're doing, and that's when those things happen. If you are a bystander and it's happening in your neighborhood and it doesn't look safe, say something. or remove yourself from that situation. Again, because it's very easy for those things to just go across the street, go into a car, which now is it's a huge issue. So I really think it's a matter of, if you yourself have already been affected by something like this, speaking up and taking the appropriate precautions, not just for you and your family, but for those around you who may not be aware.
Absolutely. Well, I want to thank both of you for, sharing with us tonight, because this has been super informative. And I think the chat, I saw a lot of, this is insightful, this is helpful to know, because it's not something we think about when we're celebrating. So thank you again, Dr. Stevenson, Dr. Ben Thompson. This has been a great conversation. To learn more about protecting your eye health and general tips for just staying safe during the holidays, visit blackdoctor.org for more information. There's articles and resources there. Have a wonderful night. Thank you again for joining us.
Thank you for having us.
Thank you.